Let me ask you about health care. You know from the U.S. Census report that came out last fall, we have 5.8 million uninsured Texans, 23% of our population. We're first among the 50 states, both in the raw number and in the percentage. Affordable Care Act now, thanks to the Roberts Court and the election of 2012, is likely not to go anywhere. Whether we think well of it or not, the particular parts of it or overall, it's likely to be the law of the land. And the opportunity to expand Medicaid with dollars coming here on a temporary basis from the federal government, you know, has been offered to many states. Yesterday, John Kasich, who is the governor of Ohio, a red governor, a conservative former...
He's red today.
He is. A former member of... former member of Congress. He finally said, basically, I give up. We're going to take advantage of the opportunity to expand Medicaid. We think that as much as we may not like aspects of the deal, we think that the money is too important. We think we can do too much with it. Our governor has said so far, hell no, not just no, but hell no. Reiterated that in the State of the State, said we're not going to expand Medicaid, so we're not going to create a health insurance exchange, which weirdly, if I understand correctly, means that the feds are going to create it. I thought we didn't like it when the feds created stuff in Texas. But my question to you is, if you were the governor, if it were your call, Speaker, would you be availing yourself of the opportunity to expand Medicaid?
Well, I'm the Speaker, and the legislature really has this conversation in front of us.
Yeah.
And we're talking about it. There's some ideas out there that are, I think, creative and interesting.
Are the ideas in conflict with the governor's point of view about not taking the money?
Well, no, not in terms of what's on the table right now.
Right.
And I think if we saw some real flexibility from Washington in terms of benefits and making sure that these patients had some skin in the game.
Yep.
There may be something where there's enough flexibility, enough definition that we can add in Texas to the program that maybe the business decision is yet to be made.
Is the compromise, Speaker, a halfway compromise? Your colleague, Representative Patrick, told me in Arlington a couple of weeks ago that her idea of a compromise in this case would be for the federal government to give Texas back all the money that we send there with no strings, basically a big cartoon bag of money with a dollar sign on it, and say, you all figure out the problem as you want to, no strings. I mean, the likelihood of that happening is probably not very high.
Well, maybe not, but it doesn't mean we shouldn't have the conversation and see.
Right.
I don't see a winner. I don't see how the Obama administration claims a victory by Texas not participating.
Right. So the idea would be that they would come to the table, but you think we would need to come to the table to some degree?
Well, I think I think you need to have the conversation, see what the right business decision is for Texas. I mean, poor people are going to get sick, they're going to be treated, and somebody's going to pay for it.
And in fact, the care they enjoy in emergency rooms is often the most expensive and the least efficient, as we know. So.
And property taxpayers in my district have to pay for it.
End up paying for it. Let's assume that the federal government and the governor cannot come to some kind of an agreement. Let's hope that there's some resolution, but let's assume that there's none. What can the state do that it has not done the last 20 years when, quite frankly, the magnitude of the problem has been like this? I mean, this is not a new problem, and yet we haven't seemed to find the money or the public policy will to deal with it. So if nothing happens with regard to the federal government, what can we reasonably expect out of Texas if we haven't seen it previously?
Well, look, even without this Washington new law, we will be tackling in the next week or two over $4 billion of Medicaid costs that we couldn't pay for in the last budget.
Right.
So,
indeed.
Listen, this isn't just because we don't want to. This is a growing, difficult problem. I had a good conversation with Chairman Colcourse the other day, who's chairman of our Public Health Committee.
Right.
I mean, it's a very, very difficult problem that's already crowding out real priorities in this state. But it's one that I don't minimize, and it's one where I hope some creative minds come to the table and try to work something out.
Can you make us feel better about this by telling us one thing that you're discussing that would be an affirmative step in the direction of solving this problem?
That people are thinking about it, talking about it, and that's what legislative sessions are for.
But nothing specific that you can offer us?
Not today.
Not yet.